Good morning. Thank you for joining us for another webinar episode. My name is Paul Newhouse with the Client Services Department at Celtex Therapeutics. The topic for today's webinar is possibilities for MS management, responding to damage from MS. Joining me today are two very special guests. The first is a man who needs no introduction, Celtex Chief Medical Officer, Dr. Stanley Jones. Dr. Jones, good morning.
Good morning. It's nice to be here. Thank you, Paul.
And then our other guest is a stem cell therapy advocate, a longtime member of the Celtex family, Samantha Wilkinson, who we know by Sammy Joe here. She's joining us from Washington State. Sammy Joe, thank you for joining us. Good morning.
Thank you, Paul. It's great to be here with you and Dr. Jones. Thanks for putting this together.
Absolutely. So we have a ton of information that we're going to bring to you today, all around the topic of MS. So we'll go ahead and get started. And just from the jump here, many of you have seen our webinar episodes, know that it tends to be me doing a lot of talking and going through information. And I'm going to try and curtail that as much as possible because I'd love to hear more from Dr. Jones and certainly Sammy Joe and her vast knowledge and her own personal experience with stem cells. So let's go ahead and get started. Today we'll talk about the cause of MS, what we know, what we don't know, the role that MSCs or mesenchymal stem cells play in MS, some of Celtex results for MS, and then hopefully we'll devote the bulk of the presentation to learning about Sammy Joe's journey because she has a ton of great insight and information to share. So the cause of MS, what do we know? What don't we know? Well, as many of you in the audience may be aware, this is MS Awareness Month in March, which is the reason why we're focusing on this topic today and have Sammy Joe speaking. And many of us obviously know what MS is, but for those who don't, it is a chronic condition where the immune system attacks nerve fibers and the myelin sheath that protects those nerves. And when that happens and that myelin sheath is damaged, communication from the brain to other parts of the body are impaired, and this results in a lot of different issues that we'll cover in some greater detail. So what's the cause of MS? Well, we really don't know. We have not yet pinpointed that in science and research. Very recently, though, there was a interesting study that came out that suggested that EBV, or the Epstein-Barr virus, the same virus that causes mono, is the leading cause of MS. This isn't yet definitive evidence, but the study strongly suggested that this may be a big clue in what causes MS. So just a little bit more about EBV. It's a very common virus, again, the same virus that causes mono. And the study found that an EBV infection greatly increased the risk of subsequent MS. In fact, a 32-fold risk following an EBV infection. The risk was not increased after infection with any other viruses. Serum levels of a biomarker of the nerve degeneration seen in MS increased only after an infection with EBV. And this was a Harvard-led study. So certainly something interesting and something to follow as time goes on. And the full study can be found in the related content tab in the right side of the slide. So those who are joining us with our webinar platform can access that full study. So this study, these findings could have significant implications for the future of MS treatment. And Sammy Joe, so you'll be first up today. In your opinion, what do you think these findings could mean for the future of treating MS?
Anything that gives us a better understanding of the cause is excellent. I mean, the whole time I've had MS, they always say it's unknown cause and, don't know what to do about it. But so that's one factor, but MS, as everybody also knows, we can't throw out all the research that's been done along the way saying that's also an epigenetic disease, meaning it's caused by multiple factors from the environment to our genes. And so there's still a lot that we need to pull all of this together, but Epstein-Barr is a big part of it. I had a bad case of mono when I was 16 and couldn't get out of bed for weeks. So it's definitely good that they're making progress.
Very encouraging. Dr. Jones, anything to add on this topic?
No, no, but I think the jury's still out on Epstein-Barr. Other etiologies are probably a significant cause. We know for sure that gut dysbiosis or abnormalities in the bacteria of the gut or an inappropriate balance in the gut can lead to brain autoimmune disease, which may be another cause of MS. But I think the jury's still out on all of that. Epstein-Barr is so common. I do a lot of Epstein-Barr testing in the office, and a lot of people have positive Epstein-Barr antibodies. So it's
Yeah.
just a big question, and I think it'll remain a question for a long time.
Sure. Yeah, certainly interesting, and interesting that you do bring up the gut as well, Dr. Jones, because I recall in some of our recent webinars on Parkinson's, a similar link was proposed there. So certainly something to follow along with. As we look at more on mesenchymal stem cells, or MSCs as we call them for short here at Celltex, we love to be clear that this is not a cure for MS, but what we'll see in particular with Sammy Joe's story and some of the Celltex results that we'll display is that the relief of symptoms of the disease is significant, as is the slowing in the progression of MS. And Sammy Joe, as we were talking a little bit prior to getting started here, you mentioned in particular about your particular condition and it being very critical to stall that progression right where it is so it doesn't advance any further. And we'll talk about that in greater detail in a little bit here. So what role do MSCs play in MS? Well, MSCs are the body's natural healing cells. They travel through the circulatory system, homing to areas in need of repair, homing to damaged areas. So they're very critical. MSCs know where to go in the body. They deliver healing factors that can regenerate new cells and tissues. So we talk about these properties of MSCs in almost every presentation because we want to, of course, make the linkage between MSCs and the particular condition that we're talking about. So just some of the general properties: immunomodulation, a fancy word for immune system regulation. MSCs are critical to this role. Homing, we just discussed, traveling to sites of injury. Angiogenesis is the creation or restoration of blood flow in the body, certainly critical for healing, circulating oxygen for the circulatory system. We talked about the self-renewal and regenerative properties of MSC. So they're able to produce more cells where they're needed. They initiate trophic activities, promote cell survival, repair damaged cells, and prevent cell death. And they're multipotent, meaning they have the capacity to differentiate into other cell types, more specialized cell types in the body. So we know that MS occurs because the immune system mistakenly recognizes that myelin sheath as a foreign object, and this initiates an inflammatory response. This inflammatory response is where MSCs come into play. So a couple of things here. We've got a few slides here where we kind of show the dynamic of basically what happens when MS is occurring in the body, and then how MSCs counteract that. So the immune system attacks and breaks down the myelin sheath. These cells include T cells, which release factors that directly break down the myelin and activate other immune cells to aid in the attack. How do MSCs respond? Well, they're able to respond to the inflammation by releasing growth factors and anti-inflammatory cytokines. These factors regulate the function of several immune cells that you can see there listed below. These factors also restore conditions needed for proper tissue regeneration and natural healing. Another thing that occurs is the process of breaking down pathogens. The immune cells release oxygen radicals to aid in the attack. These are highly reactive chemicals that destroy lipids, proteins, and nucleic acids. When the number of oxygen radicals in the area becomes too high, oxidative stress can occur. And this oxidative stress is a damaging state of imbalance between oxygen radicals and the antioxidants which stabilize them. So of course, we've all heard of antioxidants in our diets and how important those are to the functioning of our bodies and our health. So this is an example of that. How do MSCs respond to this? Well, MSCs can impact oxidative stress in two ways. First, they regulate the production of antioxidants via the secretome they release, and they directly secrete antioxidants themselves. These antioxidants can help limit the damage caused by oxygen radicals during oxidative stress. Lastly, the body automatically attempts to repair the damage that occurs from this inflammatory response. This repair process is not fully effective. Non-functional scar tissue is often left behind. This is how lesions are formed at the attack sites, causing the affected nerves to lose function over time, which obviously results in a lot of the symptoms that people experience. How do MSCs respond? The secretome contains anti-fibrotic factors, and this means that they inhibit the development of scar tissue, and this allows for more functional tissue rather than scar tissue to be generated. The reduction of non-functional scar tissue can slow the deterioration seen at an attack site over time. So, why does this all occur? Well, we all have MSCs in our body. Why aren't they doing the trick for someone who has MS? Well, as we get older, as the body's in a disease state, the body's natural native population may be inadequate for chronic inflammation or a chronic inflammatory autoimmune disease like MS. The self-replicating properties of MSCs allow for them to be cultured in large numbers and cryopreserved in preparation for such damage. And of course, that's exactly what we do here at Celtex. So Dr. Jones, question for you. What can you tell the viewers about why the quantity, or in other words, the quantity of stem cells that we're able to produce here at Celtex and in the hundreds of millions, why is this quantity so important for combating a chronic inflammatory autoimmune condition like MS?
We've been, pardon me, we've been using high quantity of stem cells for the last 11 years, and a high quantity seems to be the reason people are getting better. I can't tell you a specific number that's necessary to make people feel great. I think the quality of stem cells is probably just as important, but we're able to produce more stem cells in culture than anybody else in the world, as far as I know. So a high quantity of stem cells seems to make a big difference in how people respond. We've been doing it for a long time. We don't want to change it because people have had good results with what we've used.
And just to take that a little bit further, so let's compare something like MS to a much more common scenario, like someone who has mild osteoarthritis of the knee. And of course, Dr. Jones, you and I in our daily work, we talk to individuals who are, looking at stem cell options all over the place, a doctor, a clinic on every corner claiming to do stem cell injections. Well, what someone needs for a mild case of osteoarthritis in their knee is vastly different from someone who's had a chronic inflammatory autoimmune condition like MS. And that's even more so for someone who's had the condition for many, many years. So the quantity in a systemic condition like that is critical.
I'll just add something real quick. The body has an inflammatory condition even with osteoarthritis. Multiple sclerosis is awful from that standpoint. So the body needs a metabolic change. The body needs some ability to repair itself. A lot of stem cells that are present in our own bodies become somewhat lethargic, or they develop senescence, so they don't work very good. That's why if we culture good cells from the body and we can produce that exact duplicates of your own stem cells in high numbers, the body then responds positively. The body also responds by creating more stem cells to become more active. Intravenous or fecal stem cells increase the own numbers of our own body to produce more cells. So we're really getting a lot of benefit from exogenous stem cells that are infused into the body.
Great points. So you just alluded to this, Dr. Jones, some of our results for MS. So we'll cover some of what we've seen here, in particular at Celtech. So this is through retrospective study analysis on the reported results from our MS clients. The study took survey results from a 3-year span as clients were asked about specific symptoms and changes after their stem cell therapies. So a little bit of the demographics. We had approximately 3/4 of the individuals who were over the age of 50, and about half of these individuals had been living with the diagnosis for over 15 years. So certainly a lot of individuals who had long-standing MS. The distribution of the respondents here, about a fifth had the relapsing remitting form of MS, about 2/3 the secondary progressive form of MS, and a smaller percentage with the primary progressive form of the MS. The EDSS score, so the Expanded Disability Scoring Scale. A lot of our attendees are, I'm sure, very familiar with this, but for those who aren't, the Expanded Disability Scoring Scale basically reflects the symptomatic burden of MS up to a certain point, and then the disability burden of MS at the far end of the scale. So over half of our respondents had an EDSS score of between 6.5 and 8, and about 10% had a score above 8. And of course, the rest had scores below 6.5. And Sammy Jo will talk a little bit more about what these numbers mean when we get to her here shortly. So again, a little bit more information, some of what I just described, a 0 to 10 scale. 0 represents no disability at all. 10 represents a death from MS. A score of 4 describes a person who has mild or moderate neurological problems in one or several functional systems, but is still ambulatory without assistive devices for limited distances. And again, Sammy Jo will talk more about this, so I won't steal her thunder because I know she knows a lot about this here. So just a little more on the EDSS scores. And just so everybody knows, these presentations will be available on demand as well. So you're welcome to watch back and pick out any pieces of information that we may kind of gloss over here in the interest of giving Sammy Jo more time to talk here. The majority in this study were at a point in their disease where functional losses were generally considered irreversible, and further deterioration was typical or to be expected. The fact that many of these clients noticed improvements just speaks to the promise that MSCs show in helping those with MS. So a little bit of a broken down chart here, and Dr. Jones, I think you'd like to speak on this. Some of the frequency of symptom improvements and some of the specific symptoms with which we saw some of our best responses.
Well, what I've seen in looking at all the patients that have had stem cells that are dealing with MS, fatigue was the most significant improvement. That seems to be across the board. It also appeared to me that bowel and bladder and heat tolerability were really significant. I know that heat doesn't look like a big significant improvement or heat tolerance, but it has been, in my experience. Pain has been diminished fairly significantly, and then coordination is better. And I think Sammy Jo can address that as she speaks. Any little bit of improvement in a multiple sclerosis patient can be significant. So we can't dismiss any kind of improvement in those patients dealing with horrible disabilities.
Absolutely. Absolutely. And just a little breakdown of the response rates by the type of MS. So we did find correlations between someone being lower on the EDSS scale as being more responsive. So that will speak to early intervention, which we'll talk about. And then just the forms of the MS. So in the MS community, it's understood that, the different versions of the disease, they're kind of ranked in order. So the relapsing remitting form is known to be the less severe form of MS, which was more responsive to therapy. Secondary progressive MS being more responsive, and primary progressive MS being a little less responsive. But Sammy Jo, we're getting to your section here, but while we're on this slide, I wonder if you could share with us this was kind of something new, that there's potentially a fourth form of MS now as well?
Yeah, I've been seeing it popping up in the literature and discussed by neurologists. They're calling it relapsing progressive MS, and it definitely fits. It's the fourth phenotype of MS, but it certainly fits my experience because I was declared to be secondary progressive in 2002, but the relapses continued, and they're typically triggered by external events like getting an infection, particularly viral infections like even the common flu. A cold would make me worse, give me a relapse. A UTI, any sort of infectious agent would make a relapse where I would get worse and then, it could take a long time to recover from. But I think a lot of people will agree that, even though they're supposedly just progressive, which is supposed to be without relapses, that's not the case all the time.
Interesting. And another aspect of this disease that we'll be following along with, and really underscores what we mentioned earlier in talking about MS, what we know and what we don't know. I mean, there will always be new breakthroughs and findings that will update our understanding as we go forward. So just to wrap up this section and discuss some of the key findings from our retrospective study, the majority of the people in the study reported some level of improvement. For an older, more progressed population with a condition where continued deterioration is expected, these results were very promising, very encouraging. It was a very individualized response, just like one's own MS experience. Different respondents reported different symptom improvements, and some noticed improvements while others didn't. Those with less progressed types of MS generally saw more improvements, as I just mentioned. And although results weren't entirely predictable based on the progression or the age, a large majority, almost 2/3, felt that the repeat therapies would be needed for sustained improvements. So now that I've gotten through that, all the requisite information that we need to cover, I'm pleased to get to the section of the presentation where we can hear more from Sammy Jo and her journey, her experience. You'll find for the viewers, she's incredibly knowledgeable, not just about her own situation, but just other aspects of MS, regulatory aspects, and a lot of different things. So Sammy Jo, the floor is yours. Please tell us a little bit more about your journey with MS before you found Celtex.
Well, let's see, I was diagnosed in 1995, and that followed 4 months before that. We were in a car accident where our car was completely flipped over, and I was hanging upside down by my seatbelt, and so disoriented I didn't realize I was upside down, released the seatbelt and fell flat on my head, and had head and neck trauma from that was treated with physical therapy and tracting and so on. But I bring that up because it's another one of the multifactorial possible causes of MS. It's been documented that things like head and neck trauma can lead to MS as well. It can be part of it. So again, we've got so much to understand and bring together, but whatever the cause is, the mesenchymal stem cell therapy I've had has done incredible things to instantly give me relief from the inflammation, and then over time help regain some of the functionality that's lost. Now, it doesn't last forever, but once I got to, a large concentration of stem cells that I'd had over several years, I was able to continue in a state of remission for several years. So the other thing is that when I started the stem cell therapy in, when I started MS, I had, severe relapsing remitting MS, and it was, the neurologist told me I was likely going to end up in a wheelchair. And so at that point, my husband Doug and I decided that we're not going to have kids because, just looking at the future of this, I didn't want to be a wheelchair mom and have all the burden fall on him. So it's just throws your life up into spaghetti and on the wall, and you just got to deal with it. So we've done the best that we could. And it was, tried many things, treatments outside of the box, because what was the FDA improvements in the box had failed me. So I had to start looking outside of the box. So you'll see some of that later in the chart that I made about my treatment history.
This is my history of MS from 1995 to 2012 when I started stem cells. The first segment here is when I was using only the traditional disease-modifying drugs that were available. At first, it was only steroids. That was just to fight the inflammation from the frequent relapses, and I was doing steroids every 4 to 6 months. In 1998, I was able to start Copaxone injections, subcutaneous injections, and my EDSS line, as you can see, continued to go down. I started at a 3 because the symptoms were so bad, and then by the time I was on Copaxone, I was down to a 4 EDSS, still walking, and then I was told I was now secondary progressive and that the Copaxone was no longer working, and the only option for secondary progressive in 2002, Novantrone had just been approved by the FDA. And so I was in an aftermarket safety study. It was supposed to go for 2 years, but after 1 year and 7 doses, my heart function had gone down 10 points, which was a cutoff, but I only got worse the whole time I was on it. My EDSS was at, a little under 4, and it continued down, and I had horrible symptoms from the chemotherapy. All my veins were sclerosed, in addition to the heart damage, so a lot of cardiovascular damage there. And I started using a cane. So it was time to stop that. And the next thing that the neurologist suggested was Avonex plus monthly steroids. I did that for about 7 months in 2003 and only continued to get worse. I had a lot of immune suppression from the chemotherapy as well, so many infections. And at that point, I found out about, in 2004, by checking with other patients online, I found out about low-dose naltrexone. And so I started that, and it worked wonderfully. I went from 7, which was just needing ordered a wheelchair because I was falling so much, and jumped back up to 4. It was an incredible relief and remission, and it lasted from 2004 to the end of 2008. And then it started to fade. I got the flu in 2006, and any flu, virus, or infection always makes MS worse for me. And so things started to deteriorate, and the LDN wasn't working as well, and stiffness and spasticity came back. So I was only able to continue that a little bit farther into 2009, got another case of flu. Also, during the time I was on LDN, I didn't have to use the cane anymore that I had started when I was on the chemotherapy. And towards 2008, though, I had to go back to using a cane, and things quickly deteriorated to where I was using a walker in 2010. But in 2009, I heard about CCSVI, chronic cerebral venous insufficiency. So I had that treatment 5 times between 2010 and 2011. And at first, the relief was incredible. I had stenosed veins on either side of my neck, in the jugular veins, and 3 other central vein locations that were stenosed. And so that seemed really promising at first, but my veins were so weak, the tissue was so weak that they collapsed again, and there was in-stent restenosis, and also a webbing grew in the jugular veins that blocked them again. So the symptoms came back, and I couldn't continue that anymore because my veins were so weak. By 2011, that's when I was full-time in a wheelchair. But towards the end of 2011, that's when I heard about Celtex and stem cells. So I was down to 8.0 full-time in a wheelchair. And after my first treatment with stem cells in Houston, I had reached back up to 7.5, and I was able to use the walker again periodically.
Now, if 10 is death by MS, you could say 8.0 is I'm 80% dead already, and I've only got 20% left to go. So I'm really on the precipice, because if I go even half a point more to 8.5, then I'm bedridden. And at that point, my husband, there's only so much he can do, and he can't spend all day taking care of me, and I'd be in a nursing home at that point. So this was, a very dire situation that I was in. Dr. Jones mentioned that, when he first saw me for treatment, I was rigid and paralyzed, and it was really hard to travel to get to the treatment. So it was very difficult. But the relief was immediate. And what I've experienced over the years is that I go from 8.0 back to 7.5, giving me some functionality to use a walker again. Now, I can't use it all day long, but I can use it for walking exercises and to maintain my muscle tone and coordination. Now, the exercise, they mentioned that the fatigue, everyone noticed that the fatigue goes away, and that means you have more energy to exercise. And that's where you can restore your muscle tone and your functionality. So that's been my experience. And also, I've had 6 treatments over 10 years. And after the treatment in 2015, I didn't have any more until recently in January of 2022. So that was 7 years, and I was doing very well, remaining in remission, and actually continued to improve without any other treatments between 2015 and 2018. So I was really pleased with that.
Wow.
And then in 2018, I had another relapse triggered by the common flu. Now, I'd been living in pretty much a lot of isolation because I knew that infections could trigger a relapse and make me much worse. And so that happened in December of 2018, and I just collapsed. I couldn't get out of bed for a week. And the downturn continued for 6 months. And then I was slowly able to regain a little bit of function. Then I figured, well, I better get the flu vaccine in 2019 so that doesn't happen again. The flu vaccine caused a relapse that also lasted 6 months. So once again, I was sliding towards that, am I going to be able to maintain my ability to transfer myself and, function all day in the wheelchair at 8.0, or I'm going to end up at 8.5 and be looking at a nursing home situation. And that's when I was able to get my 6th treatment, and I've had a really good recovery already. And it's only been, that was January 12th, and here it is March 10th. So, it's been like 6 weeks.
Yeah, we'll take a look at the symptom chart that you sent us, Sammy Jo, because it's really detailed and honestly very fascinating for everybody to see. So that's a great backstory, and of course that doesn't even touch on a lot of your advocacy efforts and things like that. Maybe we'll get to that a little bit later in the Q&A. But for now, I'm going to play that one that summarizes your symptom chart. So we'll see a brief video clip courtesy of Sammy Jo here.
But the way I've kept track of symptoms since 2012 is by keeping a daily spreadsheet that I've actually started back in 2007. But then I total up the results and put them in this consolidated format. So first in 2012 through 2013, I tallied it up for every month. You can see across the top. Then what I've done is the green boxes are the times that I had stem cell treatments. So the first one was May of 2012, then May of 2013, and so on. And that's what I labeled in the videos. Then I've got the list of symptoms, and there was 28 of them when I started. The ones that are pink are the ones, there was 5 of them that went away relatively soon after my first treatment and never returned. So the way I score these is, I've got a little key here. The EDSS goes across the top, and 3 for an EDSS means 8 in a wheelchair all the time. Then I marked it 2 if I could get to use the walker periodically. So that's been going on quite a bit. There was a few downturns where I couldn't use the walker at all. Then I've got the other symptoms that I've listed here. There's 28 of them, and I just score them. 3 is the worst, 2 is medium, 1 is mild, and a 0 means that the problem resolved. So it's a lot of information. You can kind of get a feel for it by when was the good times and the bad times. And there's a long list, but when you get down to the bottom, what I did was I scored the symptoms by adding up all the 3s and 1s and 0s. And so the best years or the best time points were 5 months after the first treatment. The lower the symptom score, the better. So I started at 75 as the baseline. When I added all that up, 5 months later, I was down to 14, a 61% improvement. Then it kind of changed a bit. Had another good year in 2017, was actually as good as that 5th month after the first treatment. And that was even after my last treatment had been 2 years before in 2015. So I was really amazed by that I continued to get better. But here's the best way to summarize it. So the total symptom score, we'll just roll it up here so you can see the stem cell treatments correspond to this. So the score was the worst, of course, on the baseline, 75, and then it dropped dramatically and got a little bit worse until I had my second stem cell treatment. Then it got better again. And then after the third one, it wasn't as good. It didn't drop down as much, but slowly over time, it was getting better again. Then I had the 4th treatment in 2014, and again, it dropped after the 5th treatment, and that's where I was back down to 14, like over here. Then disaster struck. I was doing so good for several years there without even any treatments. But at the end of December 2018, I got the flu, and it just immediately threw me under the bus. I couldn't even stand up and transfer anymore, and that went on for about a week. Then after that, transfers were incredibly difficult, and I just, it was terrible for 6 months. I started to recuperate a little bit after that, and then in the fall of, actually after the flu in 2018, I got a flu vaccine, and that seemed to add to it and make it worse, but I wasn't sure, was it the vaccine or the flu that made me worse? So fearing the flu again, at November 2019, I got a vaccine again, and that also made me worse. So it was just bad. I slowly started to get better because the score started to go down. But finally, I got a break, and I decided to go and, despite the pandemic, get a 6th stem cell treatment. And then I had a dramatic drop just in, it's been under 2 months now, and I'm already back down to 18. So that was really exciting. And the other thing that I track is, of the 28 symptoms, how many are resolved. Back in 2012, all 28 were still there, but then here there was only, of the 28 symptoms, 17 were resolved at this high point, and then it went down, but back up with treatments 2 and 3. It went down, and then here, when the flu struck in December 2018, it got much worse, and only 5 symptoms were resolved. But then with the 6th treatment, now 16 are resolved of the 28. So that's real progress.
You know, if I've been able to maintain, an 8.0 and improve a little bit, what if I'd been able to get stem cells when I was at 4.0? When you are earlier in the disease and you have less accumulated damage, you also have the potential to repair and recover, and maybe I could have recovered even more and not progressed to the state I'm at now.
How do you rate your intravenous therapy versus the intrathecal therapy when you first had that in 2013 in Cancun?
The intrathecal had more immediate and profound improvements because I was in Cancun. I was down there for an extended period of time. I did both the intravenous and the intrathecal. But with the intrathecal, I was able to get up. I was waiting for the aisle chair when we got back to Seattle to come down and pick me up and get me off the plane because I couldn't, stand and walk to get to the wheelchair. But it was delayed. The wheelchair was delayed. And, the cabin crew was still in there, but everybody else was gone. And I go, hey, wait a minute. I'd been feeling better, since I got the treatment, but I was able to stand up and walk down the aisle and get off the plane. And Doug was yelling, oh my God, look what the stem cells did for her. And the cabin crew and the captain saw me and they start cheering and stuff, because they could see how excited we were. But so, and then after that, I was able to walk holding a railing when I got home and do a lot of exercise. So the intrathecal definitely had superior results. It's just that I didn't I did one other treatment as well. And that time I didn't have quite as good a result, but that first one was really amazing.
I remember picking you up in Cancun, putting you on the bed. You couldn't move a muscle in your legs. You were really paralyzed. And when you first sent me that video of you walking with a walker, I was kind of blown away. And then all of a sudden you're on a bicycle. So, you know, that therapy was just incredible to me. And it really spurred me on to keep trying to help other people more and more. So thank you for your really hard efforts to get better and better, and your support of what you've been able to accomplish with all the people in America and the world regarding multiple sclerosis and how stem cells could be of benefit.
Yeah, no, it just, I mean, since I've been medically disabled in 2002, I've been online talking with other people with MS. We're all scrambling around trying to figure out what to do, because most of us, you know, the initial treatments quit working and we're left with nothing. There's nothing left in the, you know, the traditional medical box. So we have to start looking outside of that box. And thank God I found Celtex and was able to do it. But it's made a huge difference. But yeah, it's, you know, you're driven to help people too. And I've done what I could. You know, I started efforts with starting a group with other patients in the same boat with me that had benefited from Celtex and other treatments with mesenchymal stem cells. So we started a group called patientsforstemcells.org. And, you know, we did blogging, and I ended up testifying to, you know, the FDA, pleading with them to let this therapy be approved faster, because it's not the same as a drug. It's our own body's material that a little bit more of it helps us, because we can't make enough of it on our own anymore. And the other thing that's recently I've joined up with a Facebook group that was founded about a year ago, also by patients that they had tried another treatment for MS called hematopoietic stem cell transplant, HSCT. Now, it has incredible results for people earlier in the disease, where basically they wipe out your immune system and replace it with just a small dose of stem cells, not the big dose that Celtex is able to manufacture, but they take a little bit out of your bone marrow and inject it back into your system to rebuild the immune system. Now, it works very well for some people. For other people, it works well at first, and then over time it fades. And for some people, it doesn't work at all, especially in the more progressed state. And the folks that founded this group called societywithms.org. And also you can find it on Facebook as Society with MS. And they call it with MS because this organization is patient-led by people with MS, you know, not a disease organization that, you know, is out there to, you know, for whatever, that doesn't necessarily understand it as well as people that have the disease. But we've been looking at, you know, all of these treatments, and the folks that founded that group had HSCT and it didn't work. So they're still looking outside the box, and that's a lot of them are here today watching, so they can have a better understanding of stem cell therapy, because that's actually one of the most advanced treatments. And there's several different biotechs that have FDA approved trials, as well as what Celtex is doing for multiple conditions, not just MS, but have FDA trials going for various forms of arthritis. So you're really pushing forward on finding a solution to these drastic, untreatable diseases that have no other options.
Well, I'd also like to mention to everybody that we haven't ever had any significant reaction or abnormality or sequela from one's own stem cells. So we use autologous cells as opposed to cells from somewhere else or somebody else. And our results have been phenomenal from that standpoint. We don't want any reactions. We don't want any complications ever. And we've really not had any. So I think autologous cells are obviously the way people should go. You don't have to worry. You can have repeated therapies with your own stem cells forever. You put your stem cells in the bank once from a small fat extraction, and cells are there anytime you need them. So You've done that. I think you had your first fat extraction in 2012, and you continue to use your own stem cells every time. You haven't had another fat extraction, have you?
No, I just had that one in
Just that
2012.
one. And that speaks volumes for most people, because fat extractions are not always that comfortable. Bone marrow extractions are certainly not comfortable. And we really promote autologous cell therapy for that reason as well.
Oh, and Paul mentioned that you have a new innovation I didn't know about, but you can, maybe Paul, you're going to go into this later, but you can prepare the cells and have them frozen and ready to go. Like if I had a bad relapse or I got the flu again or something, I could get those cells ready right away or shipped to me, or, you know, somehow get them without having to wait for that period when you have to grow them in the lab.
I'm smiling
Yeah,
because y'all are doing my job for me. So Dr. Jones
Sorry.
just talked about it's okay. You guys covered it. Dr. Jones talking about the banking process here, the fact that once we create a foundation bank, as we call it, the cells can be drawn from again and again and again. No more extractions needed, as you confirmed, Sammy Joe. Of course, we have a very high-tech laboratory that follows standard operating procedures, quality and sterility testing, an ISO class 7 clean room, I believe, and a secure cryopreservation of banking of your stem cells. So that's the first step in the process. Everybody should take that step at least to have the stem cells ready. Then there's a lead time typically to get cells that are banked ready for therapy. Sammy Joe, as you were just talking about, we actually have, in addition to foundation banking, a new offering called safeguard banking, where we're essentially pre-preparing a dose of stem cells for therapy for immediate use. So there's no lead time in taking out of the bank. It's basically ready to go. So this is great for people who just want to have that insurance policy there. But just to give some examples of scenarios where this may be critical: a heart attack, a TBI, God forbid, car accidents, or lung damage associated with various conditions, a stroke. These are unexpected emergent type events where time is of the essence for someone to intervene, very quickly. 3 weeks is okay. That's okay. That's how quickly we can get someone's cells from the bank and cultured for therapy. That's fine. But getting cells within a day or two is certainly much better. Dr. Jones, do you have any comments on safeguard banking and having cells ready for immediate use?
Well, I'd just like to tell everybody, if you had a stroke, for instance, the sequela from a stroke is usually impaired speech, hemiparesis, or paralysis. That doesn't have to necessarily happen if your own stem cells are ready to go. If you can get stem cells within the first week after that horrible accident occurs, you can prevent the scar tissue formation that causes the paralysis or the speech impediment. So yeah, it's always great to have stem cells available, and we can get them back to you straight away. And that really prevents a lot of problems for anybody in the future. The other thing I'd like to bring up is Sammy Jo mentioned, had she had stem cells right after she got sick, she wouldn't have had the sequelae that she's had later. I see a lot of patients that come in that have been seeing doctors for some time, and the doctor's trying to make a diagnosis. Well, you can wait on a diagnosis, and then all of a sudden, finally, you have a horrible event. And then sure enough, there's the diagnosis. Uh-oh, I waited too long. So what I really want to do is get people prepared to have stem cell therapy available to them before anything gets worse. It's not difficult for me to see somebody that's beginning to have problems with some weakness or some inability to move a muscle or a joint. That's probably the start of multiple sclerosis. So get the cells banked and then go ahead and start therapy. It's not going to harm anybody. I see people with Parkinson's disease that come in and the doctor is trying to get a diagnosis. Well, by the time you get the diagnosis, Parkinson's is already too advanced. So I just like to emphasize, anytime we can get people early on, we can really prevent progression typically.
Thank you, Dr. Jones. We're going to start wrapping up here. We want to be respectful of everyone's time, but we'll get a few more points in here. I do have a couple questions for you. First one for you, Dr. Jones. Second one, actually, maybe both of you can give your input on. But the first one, Dr. Jones, is we had somebody ask, is MSC treatment efficient for everyone?
Well, no, it's not efficient for everybody. I mean, I see a lot of people who have disc herniations and they want stem cells to alleviate the need of surgery. Other people have other maladies that can't be made better with stem cell therapy. But when you look at autoimmune disease, you look at most people with horrible disorders, autoimmune disease is the primary reason, whether it's cerebellar atrophy or multiple sclerosis or Parkinson's or rheumatoid arthritis. That's all autoimmune. It's initiated by probably gut dysbiosis or some other means. It's probably the environment. It's maybe the foods you eat. But for that reason, yeah, stem cell therapy can be very efficient if you treat the body metabolically and get the body metabolically balanced.
Well, and of course, no therapy or treatment is ever 100%, unfortunately, but we certainly continue to look at things as we're doing them. As we talked about, we don't know everything about MS or MSC, so as new science and data emerges, we can adjust accordingly and try and get as close to 100% in the future as we possibly can.
Well, in my own case, I'd just like to bring that up. In 2009, I was in a wheelchair intermittently because I couldn't function due to horrible joint pain due to psoriatic and rheumatoid arthritis. I have had stem cells now for the last 11 years intermittently, and I function perfectly now. I never did take any other medications after my initial disease was diagnosed, and it's prevented me from having disability for all these last 11 years. So it's been very efficient or effective for me for a long time, and I see that in a lot of people.
As you guys talk about this next question, I'll just display a couple things here on screen. So here's the question, and in the audience, just take a look at what I'm displaying here on screen as far as some options for more information interacting with the Celtex team. But the question is, a gentleman asked, for people with secondary progressive MS that have no results on their first go round with therapy, should they try that again? What do you think, Dr. Jones?
Yeah, I think so, but I think they need to be tested for other allergies, other autoimmune issues. We're doing a lot of testing now to find out environmental toxins that might be present, or whether you have gut dysbiosis, or what does that mean? It means that there are too many abnormal bacteria in the intestinal tract to allow the good bacteria to function as they should. So you get what's called a leaky gut, or the cells of the intestinal tract separate, toxins get into the body, they get in the bloodstream, they go to the lymphatics, and they work their way into the nervous system. So yes, I think that needs to be evaluated, and then a treatment again should be initiated for sure.
Sammy Joe, do you have anything to add there as far as what you know, or anybody in your MS community or groups?
I would agree with. I'm really glad, Dr. Jones, that you're taking that holistic approach, because yes, I mean, supporting the system by restoring the gut function, because the majority of our immune system actually comes from the gut, if my understanding is correct. And so that's why, everybody, in our groups and so on, we support each other with information on what's the best diet for MS. And that's important, because then you're not putting bad stuff in there like sugar and dairy and other things that can inflame MS. And there's lots of good resources out there, like the Embry family. Their son had severe MS, and they put together the best bet diet, and there's even a free cookbook when you go find that information. But we have to take this from a holistic approach, and that's really important. But another thing, just what you said about the lymphatic system being affected by this, that's another treatment that I had out of the 3 modes that you have: the intrathecal, the IV, there's also the lymphatic injections, and I had that, and I also found that to be a very immediate response. Maybe because rather than going through the bloodstream with an IV, it's going right into the lymphatic system where a lot of the problem is. Is that correct?
Yeah, we learned that a long time ago, and I think the functional medicine aspect of all these stem cell patients is really important.
I agree. And I'll just add in what you mentioned much earlier in the presentation, things like exercise, physical activity, working on your body, I think is important for everybody. So we inject that into each webinar at some point in time. I do have one last question in the queue before I get to that, and then we'll wrap here. I just want to mention that our next webinar will be in about 2 weeks, Wednesday, March the 23rd, again at 11 a.m. Central. Focus of that presentation will be TBIs, traumatic brain injuries. So tune in for that one. So last question here for MS, Dr. Jones, and of course this is variable, but just to give an idea of the considerations here. For MS, how many treatments will the average person need, and how many years? Everybody asks these questions because they want to know. There's no definitive answer necessarily, but Dr. Jones, what are your thoughts on that?
Well, I think you go back to what Sammy Jo said earlier. She had two different types of therapies initially, and that kept her really good for some time. I think she said she had one therapy in 2015 and didn't have any more trouble until 2018. So she went 3 years or so without any advancement in her disease, and she stayed fairly stable. It's very individualistic, and so I really can't give that idea or that question specifics, because we treat people usually with 3 intravenous therapies. That's the magic one, we think, is 3 individual therapies using intranasal therapy and intravenous therapy. Now, intrathecal therapy is an additive, and just like Sammy Jo said, it really made a big difference in her. So I would think, and we've seen that with Parkinson's too, the people that have Parkinson's do better with intrathecal injection initially. So I would think the initial therapy should be 3 intravenous fusions, 3 intranasal therapies, and then 1 intrathecal injection. And then let things go, see how people respond. And based on that response, then you recommend other therapies as needed. Yeah, there's not a blanket statement on how people will do and how many therapies they will need.
Sure. Thank you, Dr. Jones. Well, I think this concludes the presentation. Dr. Jones, I know you've got patients to see this afternoon. I appreciate you taking the time as always. And Sammy Jo, definitely appreciate everything that you contributed. I know a lot of work went into this webinar. You provided such great information and insight. We sincerely appreciate you being a part of the Celtex family. So thank you both so much for joining us. Thank you to everyone in attendance for joining us. So if either of y'all have any parting words, please let us know, and we'll wrap up here.
Well, I would like to thank Sammy Jo. Sammy Jo initiated a fire in me that wanted me to progress and do better and do more for all of our patients to get stem cells. Her response was just amazing to me, and Sammy Jo, we stayed in touch for over the years, and I appreciate you very much.
Well, thank you, Dr. Jones. And I just want to thank everybody at Celtex for keeping me alive so I can be here and chat with y'all today. And, especially even, I always think about the folks in the lab, in those hazmat suits. It takes, a half an hour to get rigged up in one of those. And so I just want to thank them too. And the founders of Celtex, Dave Ellers and Candy and Eric and everybody that's, just been slugging away at this. And, thank you all, and I hope that this can become available to all patients that need it.
We'll certainly keep working on it. Thank you, Sammy Jo. Thank you, Dr. Jones. Thank you for everybody attending. Everyone have a great day, and we will see you again on Wednesday, March the 23rd. Have a nice day, everyone.